Continuing with me, this is video 2 in the Pico method, and I'm Carrie Milner, an Associate Professor of Nursing in the Davis and Henley College of Nursing at Sacred Heart University. And let's review from the video 1. So Pico is a mnemonic used to describe the 4 elements of a good clinical foreground question. And if you're not familiar with the term foreground, that means that it's a specific question that you want to find specific evidence on, versus a background question would be more like, what are the options for preventing falls? Whereas a foreground question would be, is the Morse or the Heinrich tools better for preventing falls? So this little grid here shows P again. And you have, that's for population or problem, and you try to describe as accurately and concisely as possible the patient or problem, or the group of patients of interest. I is for intervention, and you're going to see I'm starting to weave in cause or prognosis, because in this video you're going to learn about the different types of Pico questions. So what is the main intervention or therapy? Comparison is for C. Is there an alternative intervention or therapy to compare? And then the outcome is O. So the types of Pico questions, we're going to start with the intervention type because we spend most of our time here, figuring out or wanting to find evidence on what intervention is the best for improving whatever outcome. So intervention questions are used to determine what treatment, therapy, or action leads to the best outcome. And what just appeared is the template, and I highly suggest that you always use templates to draft your question so that you will get the Pico question correctly. So in blank, how does blank compared with blank affect blank? And we will have some examples shortly in the next video. Types of Pico questions that are etiology questions are used to determine the causes or origins of disease or the identification of the greatest risk factors that predispose one to a disease. And here's the template for that. So are blank who have blank compared with those without blank at blank risk for blank. And then there are diagnostic test or diagnosis types of Pico questions, and these are used to determine what test is more accurate and precise in diagnosing a disease. And the template for this is in blank, are blank compared with blank as good in diagnosing blank. And then there's prognosis and prediction questions, and they're used to determine what treatment or action leads to the best outcome. And the template for this is in blank, how does blank compared with blank predict blank? And then the last type of question is meaning. And meaning questions are used to determine the meaning of an experience for a specific individual, group, or community. And you'll see for this one, you only have a P, an I, and an O. So how do blank with blank perceive blank? So no comparison in this one. So we will continue to explore how to use the Pico method to practice developing the different types of questions in video 3.